And then, as we said, this comes here. So obviously we will need a ligament or something to keep this inside or support this, and it's called the transverse ligament or transverse atlantal ligament. And then the ligament.
And these two ligaments basically attach both sides
yes,
of, you have
in here. The ligament, yes, we have the transverse tubercles for the ligament, for the atlantal ligament to attach there. And then we have the inferior facets, and the inferior facets of C1 or the atlas goes with the superior facets of the axis or C2. And this basically makes us go to C2 now. This is also one of the atypical ones, and what makes it atypical is the edontoid process. It has an apex and it has a neck, and this place is called the pedicle, which basically connects, or the border between, there's no border, but like it connects the apex to the C2, to the body of C2. And we have the laminas. This is the first cervical, if we go in order, that has the bifid spinous process, which
So
basically means that it has two wings.
So this is where bifid starts to occur.
Yes.
Starting from C2.
Exactly. And again, as we said in here, that we have the fovea dentis in here. So the anterior facet of the C2 goes on the fovea dentis. And what else? We have the inferior facets, which goes on the superior facet of the C3. And we have the body, we have the foramen, this is the transverse foramen, and we have the transverse foramen and the vertebral foramen. And I think this is about it for this.
Yeah, ask some question.
Okay. Show me.
Start. We finished over here. We stopped over here.
Okay. Point out one of the things that makes this atypical.
So our question was, it was understood. Can you tell them your question?
What is one thing that makes the C2 atypical?
C2 atypical, that's...
Yes.
Okay, good.
Can you name the facets?
The faucet? This one?
Yes, that's one of them.
Anterior dense faucet.
Yes. Can you tell them what is
C1.
Yeah, this or this. One thing we can talk about the spinous process of that. What makes it different of the C2?
C2.
This one there's
C2.
Oh, this one.
Yeah.
It's bifid, and in this one there is no spinous process.
What is atypical about C1?
About C1, it has no spinous process and no body.
Okay, nice. Okay. So do you want to
So
continue?
we also said that there's a difference between C1 and C2. So for instance, in terms of the presence of the groove, the vertebral groove, is there any difference in that?
This one's triangular, this one's not.
No, I'm talking about the groove for the vertebral artery.
No.
Okay, pass. Same question. Okay, who likes to answer that question?
Professor, can you repeat?
Okay, everybody listen. Okay, everybody listen. Hold on. So my question is so we have the groove for the vertebral artery, right? We showed that.
Yeah.
So is that groove present in C2?
No.
Only in C1.
Is it where is it then?
C1.
Okay, so because why? Because it curves around and it goes up, right? So that curving groove is only located in C1. Okay, you don't see that. So that's another difference. When you say difference between C1 and C2, that's another difference.
Yes.
So you don't see, so the groove for the vertebral artery is not present in C2. That was my point. Okay? Did you get it?
Yeah.
Say it, repeat.
There's no groove in C2, but it's present in C1.
Okay, good. Okay, so
More question?
so what's the shape of the body? The corpus of C1. C1.
I can't answer that.
Okay, pass that. So what's the shape of the body of the body of C1?
There's no one.
كنت بدي اقول بس حسيت انه غلط.
Okay, so that's. So what's the importance of the transverse ligament?
Transverse ligament.
Next.
It passes the
Say it.
nerves. It passes the artery nerves.
No. You say it.
I don't know.
Okay,
Is it all the odontoid process to the...
Exactly, show it.
Okay.
Can you show it?
So...
So those transverse ligament attaches on either side, the tubercle on either side. Show the tubercle. The tubercle.
So this is the tubercle. 1 second. So it's
Right.
like this.
Right. Show where's the
So-
ligament?
This is the ligament right here.
Right.
Holds the atlas to the axis.
Right. Well, no. It's located on either side of C1.
From here to here.
It's on C1 level. It crosses. It basically connects. It connects on either side. So in front of them you have the odontoid process. Okay. And at the back you have the foramen. Okay. So it stabilizes the odontoid process on the fovea. It pushes the fovea. Stabilizes the fovea. Okay, good. All right, thank you.